The Social Services Subcommittee will come to order. Madam Clerk, if you can open the roll so that we can mark our attendance. Thank you. Please close the roll. Did Higgins get recorded? I'm sorry. Can we just open it right back up for Delegate Higgins?
You get paid the same.
Yay. Awesome. Thank you. So we have some administrative actions we need to take. We're going to take House Bill 449 by for the day. House Bill 449. I don't know about this. Okay. Yes, and this one too, 449. I think that is a voice vote. All those in favor say aye. Aye. Any opposed? Thank you. We'll also take House Bill 453 by for the day.
So moved.
Thank you. All those in favor say aye.
Aye.
Any opposed? Great. House Bill 855 is also going to be taken by for the day. Thank you. Can you second?
Second.
All those in favor say aye.
Aye.
Thank you. Any opposed? Great. House Bill 855. All right. And then House Bill 1476, the patrons asked us to strike that bill. So that is a recorded vote, Madam Clerk. Thank you. The motion has been seconded. It's properly before us, and Madam Clerk will open the roll. That's a recorded vote. Thank you. All right, please close the roll. That House Bill 1476 has been stricken from the docket by unanimous vote. Okay, now we'll start at the top. I see Delegate McQuinn. Are you ready? And I believe the delegate has a substitute.
Good afternoon, and thank you, Madam Chair. I do. So I, at this time, want to offer the substitute motion for the substitute.
Madam Chairman.
Yes.
Delegate Orrock?
But before we act on that, given that we don't get the substitute language, it's not been released until we act on it, could they just explain what the difference is, or is it released? Okay, my bad. I'm sorry. Never mind.
You okay?
Second. Thank you. All those in favor of adopting the substitute, say aye. Aye. Any opposed? Great.
All right. Thank you, Madam Chair. Madam Chair and members of the committee, this particular bill, House Bill 241, is a bill that's been in the making since 2020, actually, and been through many, many processes. And so I'm hoping we're at a place now we might could get to where we're trying to go. But what it does is authorizes the Board of Health to license prescribed pediatric extended care center. The bill establishes the scope of the services offered by these centers and the requirements for operations, management, staffing, facilities, and maintenance that direct the board to regulate and implement the provision, actually, of the bill. But it is the prescribed pediatric extended care center is an alternative option to address the gap that exists in the current model of care, where only often private duty nurses, care attendants, or long-term residential placements are the only thing that's available for these particular children. It makes those children young people who are eligible would be the same as those who are currently qualified for skilled nursing or private duty nursing, but except they would be in a facility where there would be, many ways to attend to their particular needs. The services support continuity of care, and which also decreases the kind of care that they would be eligible for and what they will receive, would also decrease hospitalization through early detection and improvement for outcome. It also allows for the socialization of these young people, again, who are often their disorder are things such as seizure, chronic lung illness, congenital heart disease, spinal and cord injury. And so they are some of the most vulnerable young people, and we're this particular program that actually exists in places. Florida has a lot of them, Texas, Kentucky, and there are others who are here today could even tell you about more. But it also supports the caregivers. And so I'm asking that as these individuals who are here today to speak to this and then hear the full, get a full understanding of what these places and the services that will be provided, that you would look favorably upon it. And Madam Chair, again, there are quite a few folks here who can speak to it much more than I can.
Thank you so much, Delegate McQuinn. Are there any questions from the members of the committee? All right. We'll take some public testimony. Please stand up and please queue up if you are here to speak in support of the bill. And if there are lots of folks who really welcome the public input, but please keep your remarks to be succinct so that we can hear from everybody.
We also, excuse me, Madam Chair, we have the health department that's here, Virginia Health Department as well, who's supporting this. And just let me say this is the disclaimer. Brittany Jordan brought this to me in 2019 and asking that we will look upon this and to see if it's something that we would establish in Virginia.
Great. Thank you so much. Ms. Jordan, did you want to speak first? And then also, I just want to make sure, since Delegate McQuinn mentioned there's the Virginia Department of Health, if you want to also have any words about this particular bill, that would be helpful too. And maybe, Ms. Jordan, maybe it'd be helpful if we heard from the Department of Health, and then I'll let you go. Thank you.
Good afternoon, Madam Chair, members of the subcommittee. I'm Rebecca Allen with the Virginia Department of Health, and the department approached the delegate with the substitute that you all have before you today. And so if there are any technical questions, we are here to answer them.
Great, thank you. Do you officially support this bill, or did you provide only technical assistance?
Technical assistance. We were authorized to share the amendment with her.
Great, thank you so much. Thank you. Ms. Jordan.
Good afternoon. And I'm Brittany Jordan. I'm a registered nurse at the Children's Hospital of Richmond. It's my pleasure to stand here today to represent and advocate for a population of people dear to my heart, children with complex medical needs and their caregivers and families. Growing up a caregiver with a cousin with complex medical needs and technology dependence, I witnessed firsthand how difficult it is to navigate the system. As a pediatric nurse of 14 years, a majority of those years working with children with medical complexities and technology dependence, I've spoken to hundreds of families who have the same issues, oftentimes forcing them into isolation because until you've really witnessed it firsthand, it's truly impossible to wrap your head around what they face every day. Implementation of prescribed pediatric extended care, or PPEC, would be a huge step forward in supporting the continuum of care for this population. Currently, there is no safe option for facility-based child care for children with complex medical needs, and options for children with technology dependence are very few. These children require around-the-clock monitoring and specialized care by licensed and trained individuals in order to maintain functioning and preserve their health. Even children of school age in this population often require one-on-one monitoring in the school system, which is not achievable unless they have a private duty nurse present. And there's a significant shortage of nurses available for the number of children who qualify for the need nursing. This forces parents out of the workforce as they are the sole option for providing care around the clock for their child. With the PPEC model, all staff are either licensed or trained to work with children to meet their individual needs, and this provides a safe environment. The collaboration with the child's primary care physician and daily oversight allows for the mitigation of health issues that could and would otherwise lead to hospitalization or worsening illnesses. PPEC minimizes risk for delayed or misdiagnoses. The model adds the ability to receive coordinated care at a single site as opposed to families having to travel to receive the therapy services several times a week to meet their developmental goals. It also provides the child with an education and socialization needs that are not supported by the private duty nursing option. PPC ensures better utilization of services by providing them all under one roof and has the potential to reduce costs because instead of it being reimbursed individually, it would be bundled into one or two services and more children would be serviced at once. It also allows parents to continue employment and rely less on social services to sustain their family. As a nurse, I encounter families every day who, through their resiliency, have survived but have not been able to function due to families as do the families and of children without medical complexities, simply because our society is not designed to support children with complex medical needs, and it truly disrupts the family dynamic and further widens the gaps for disadvantages that already exist in so many instances. PPEC would also lessen the burden of the caregivers by providing consistency and assurance that their children with medically complex needs are left in trusted and capable hands, and the parents and caregivers are more prone to secure and maintain employment. Every day, children are born with genetic conditions or suffer brain injuries or other injuries, leaving them technology dependent or relying on multiple specialists to manage organ systems to maintain good health. Every day, our modern technology and medicine saves the lives of premature newborns born earlier than ever before. And many times, by nature of being born prematurely, these children need early intervention services and therapies and medical interventions and technology to maximize their outcomes and to give them the best chance at catching up developmentally and cognitively to their counterparts. And sometimes the goal is just to preserve their health and to have the health that they have and improve their quality of life. Whatever the case, PPEC would provide an option for supporting their goals in every situation, and as the numbers continue to grow, the more pressing it will be to build solid groundwork to create better and more stable lives for these families. And I and just about every family of children with complex medical needs in the Commonwealth of Virginia would appreciate your support for this bill. Thank you.
Thank you very much for your passionate testimony. Thank you. If others would like to come forward and support, please, we would really, we have a full docket. We'd really love for all the public testimony to be heard. So if you can give your remarks very succinct. Thank you.
Good afternoon, Madam Chair, members of the subcommittee. Thank you so much. My name is Berrigan Nelson. I'm a pediatrician here in Richmond and get to work with Brittany. And I'm a member of the Virginia chapter of the American Academy of Pediatrics. We stand in support of this bill for greater inclusion of safe care for children with medical complexity, and so parents can go to work. Thank you so much.
Thank you. Is there anybody here to speak in opposition to this bill? Oh, we also have folks who are online. My apologies. All right. Okay. Can we pull our online folks on? These are folks who signed up to speak in support of the bill. Thank you. Oh, I can't see that part. Oh, Dr. Tiffany Kimbrough.
Hi, thank you for this time and for the attention to this bill. I am a general pediatrician at the Children's Hospital of Richmond and take care of a lot of these children who are living at home and living fuller, longer lives. But this is a very apparent care gap for families to be able to take care of their complex child but still remain in the workforce. So we know more and more families choose to stay home because they have no other option, and therefore rely on increasing social supports in order to do that to support their family. So this option not only provides safe care for the family, but allows for the family to continue to have gainful employment. So I support this bill for our families here in the Commonwealth.
Thank you so much, Doctor. Dr. Linda Dean Duro.
Did I mute myself with my video? Hello, I'm Dr. Linda Dean Drew. I'm a pediatric dentist from Ashburn, Virginia, and I'm here to plead for your support, Madam Chair, for the pediatric extended care centers. As my other colleagues have said previously, these vulnerable group of children require a holistic environment that is nurturing for them to be able to reach their God-given potential. And this will also be an invaluable resource for families as well. And so let's just look at this as an investment as a community in the future and empowering our next generation of vulnerable children. So I sincerely hope that you will consider this bill.
Great. Thank you so much for joining us. Kevin Graham.
Good afternoon, Madam Chair, and to the rest of the subcommittee. Certainly, I'm the chaplain at Shorebrook Road, dealing directly from the spiritual care practice with children who deal with these complex care needs. And I see on a daily basis firsthand how this bill would be so helpful to helping other kids that are in that environment have other options than where they are currently. And I just hope sincerely that you and the committee would consider this bill to go forward so that those kids and others like them would get more opportunities to be treated in a home environment and spaces that they can go to daily and have their parents also still be able to maintain their lifestyle to care for their children. Thank you so much.
Thank you so much. I think there were others who signed up, but we don't see them in the virtual room. Are there any folks who are here to speak in opposition to this bill? All right. Are there questions from the committee? Okay.
Madam Chair, I'd move to report and refer to appropriations.
Second.
There's been a motion to report and refer the substitute to appropriations for House Bill 241. That's okay, we're all good. Madam Clerk, if you can open the roll, please. There was a second, I think.
Yes, I just seconded.
Delegate Srinivasan seconded. Yes, please.
Bless you.
Delegate McQuinn, thank you so much for your persistence and advocacy. House Bill 241 is recommended to report and refer the substitute to appropriations by a vote of 8-0.
Thank you. Thank you, committee. Appreciate it.
Thank you. Next, I think I saw Delegate Glass was in line. Delegate Glass.
Let me see. Good evening, Madam Chair. I have an amendment in the nature of a substitute.
Thank you, Delegate Glass. Do we have the substitute, Council?
Yes, Madam Chair, it should be available on LIS shortly.
Would you like to speak to it, or should we move the substitute? Delegate Orrock?
Yeah, Madam Chair, given that the public doesn't see the substitutes, I think it would probably be a good practice if the members would explain the differences so they would at least know what we're acting on before we take action.
I think that's fair. Delegate Glass, can you tell us how the substitute differs from your underlying bill?
So I think initially, the initial draft that we got back was not exactly what we were looking for. I'm trying to remember. I think it was we were all in two different worlds with the actual bill. And so what the substitute is essentially what we were looking for, the bill that I'm going to explain, or what we were looking for from DLS. Am I correct in saying that? Yeah. So I'm saying that because it was the initial draft that we got back, which was later in the game, it didn't best describe what we were trying to do.
Delegate Glass, could you then describe what the substitute does, and then we can.
Substitute turns the bill into a dynamic benefit definition based off of the social services survey that was done previously. So it explains what a dynamic benefit is and has the benefit, what that looks like, and what we're asking Department of Social Services to essentially create and report.
Thank you, Delegate Glass. I see that the substitute is available online now.
Yes.
I'm on LIS and I
substitute, Madam Chair.
We have a motion to adopt the substitute.
Second.
Great. All those in favor say aye.
Aye.
Any opposed? Okay, the substitute is properly before us, and if you want to speak more to your bill, Delegate Glass.
Gratitude. And I'll be mindful of that because I think I've heard that several times about the substitute, just as several of my bills have substitutes. So this bill really represents, I wanted to say proactive approach, but really it is a reactive approach to a comprehensive report that was requested by the General Assembly of Social Service, addressing this sort of critical issue of the benefits cliff in Virginia. It proposes an actual approach to addressing it with this dynamic benefit adjustment system. So this system aims to adjust the eligibility in alignment with the eligibility in alignment with thresholds to gradually reduce folks from public assistance program rather than just taking that public assistance program away as soon as they no longer are eligible for them, or they make a little bit more money. The key aspect of this system is really based off of the real world data that the Commonwealth already uses, so minimum wage, inflation rates, cost of living, and sort of tailoring a reduction to benefits based off living indexes. What's happening right now is you have folks that are eligible for things like TANF, and the moment they go $1 over the threshold, that benefit is automatically taken away, which puts them in a position where they're back in need of that particular benefit. The report that was put out to us in 2020 said the negative consequences, and I'm going to quote the report very briefly, and I think that explains most of what we're talking about here. The negative consequences of the benefits are well documented. The cliff is a significant barrier for moving from government support to self-sufficiency. It constitutes a sizable income package. So more than 70% of public assistance recipients are unable to support their families or make ends meet after they leave programs. And so households may not have enough money or enough income to replace the lost benefits and become self-sufficient until they meet 2 or 3 times the poverty level. And that's shown by research. So the goal here is, again, to create this system where if I start making $2 over, or the Department of Social Service would determine what that, how that adjustment would be made, and that's what we're calling for them to do in the bill. But if I make about $2 over than my eligibility, instead of completely losing that benefits, I get $2 or $3 less until I have come to a place where I'm self-sufficient and no longer need that benefit.
Thank you so much, Delegate Glass. Are there any questions from the committee? Delegate Srinivasan.
Thank you, Madam Chair. Delegate Glass, my question is more clarification. Very intriguing concept of guiding someone through as they go to the cliff. Would we need a software to implement this in social services? How would this data be collected and analyzed and processed?
So we already have data on cost of living, tax index and things like that. So social services, this is calling for them to determine what it is that they need and report that back to us December 1st of how they plan on being able to create this dynamic benefit so that we can start implementing something that allows for self-sustainability and economic freedom for those using public assistance.
Got it. Thank you.
Thank you. Delegate Orrock.
Thank you, Madam Chairman. How does this tie in with the current federal funding that we receive?
Okay, so there are some federal programs that, this is in reference to programs that Virginia actually has some control over, like TANF and SNAP. Can't remember.
Well, Madam Chairman, maybe to rephrase the question.
Delegate Orrock.
So I presume this will cause us to accrue greater cost on the Commonwealth. That the feds will not necessarily match this as they have in other parts of this.
There would be no need to match because what's happening is people are coming off of public assistance gradually. So as an example, I had a neighbor who wanted to start her own business. She did start that business during COVID. That business started booming. It was doing well. However, with her 9 children, whom she takes care of very well, she had food assistance. The moment she made $1 over, she lost that assistance, and it was really difficult. So there isn't a cost. It's actually probably better for us because she did get off the benefit. It was hard, but what she is a tax-paying citizen providing back to society in a way that's more meaningful than her staying on that benefit. And I'm talking about food here, but we're also talking about health benefits, disability, and things like that as well.
Thank you, Delegate Glass. Are there any folks in the audience who would like to speak in support of this bill? Are there folks here who would like to speak in opposition to this bill? Oh, I'm sorry, there was one virtual. I have to keep track of my virtual list. 1426, yes, we have one person virtually. Mrs. Leah Williams-Rumbley? Go ahead, ma'am.
Good afternoon, Madam Chair. Thank you for the opportunity to speak in support of House Bill 1426. I am the Chief Programs and Innovation Officer at the Food Bank of Southeastern Virginia and the Eastern Shore. And we know firsthand that the benefits cliff occurs when families begin to lose their benefits as earnings increase. And in most cases, the loss in benefits equates to significantly more than the increase in earnings. And so the result is that families earn more without actually improving their financial situation. We witnessed the effects of the sunsetting of pandemic era benefits programs in our region. And because the emergency benefits were retracted all at once rather than gradually over a period of time, many in our community were forced to skip meals or seek out free food distributions just to keep food on the table. That same benefits cliff concept can apply when income fluctuates, creating a system where a small boost in income can lead to a total loss of the benefits that are relied on to make ends meet. House Bill 1426 would create a nimbler benefit system that does not penalize recipients for seeking out higher paying jobs or pursuing opportunities that could improve the economic prospects for themselves or for their families. So the key provision of the bill, establishing a dynamic benefits adjustment system for the gradual reduction of public assistance benefits in response to increases in beneficiaries' earned income, reflects a forward-thinking approach to addressing the evolving needs of individuals and families relying on public assistance programs. This approach ensures that as beneficiaries' earned income increases, the reduction in benefits is balanced and equitable, and it promotes self-sufficiency while avoiding abrupt and significant drops in assistance. So significant attention should be given to identifying the point where work pays off. The benefits cliff creates a poverty trap where the risk and gains of working become disincentives and barriers to self-sufficiency and economic mobility. We want people to get off of public assistance, but we want them to do it permanently, and we want them to do it with confidence, and we want them to do it in a sustainable fashion. So the goal is to engage in revitalization efforts that index the assistance so beneficiaries become eligible and prepared to cross the benefits cliff and become economically self-sufficient for good. Thank you.
Thank you so much, ma'am, for your testimony. All right. Committee members, we operate by motion. And I think if we choose to report this bill, it does need to be referred to appropriations.
Madam Chair, I'd move to report and refer the substitute to appropriations.
Second.
Right, there's been a motion to report and refer the substitute to appropriations, and it's been seconded, so that's properly before us. Madam Clerk, if you can open the roll. One second as our technology catches up with our speed. All right, let's see if it'll work. Our reporting system. Madam Clerk, would it be possible for us to do a roll call vote? I think that's the right term. Okay. All good. No patience. So we're just going to vote by roll call since until our IT system can catch up.
Aye.
Aye.
Aye. Delegate Orrock?
Aye.
Delegate Walker?
Aye.
Delegate Higgins?
Aye.
Delegate Tran?
Aye. And so everybody has voted who's present in our committee. Delegate Glass, we recommend that House Bill 1426 be reported and referred with substitute to appropriations by a vote of, I believe, 8-0.
8-0. Gratitude, Madam Chair.
Thank you so much. Up next, we have Delegate Bennett Parker.
Thank you, Madam Chair. This is House Bill 1128, and I have 2 line amendments to offer.
Great. Would you like to report them or would you like counsel?
I would love counsel to report them.
Okay, counsel.
There are 2 line amendments. First is line 438, introduced after jurisdiction, strike or another trained child forensic interviewer. The second is line 479, introduced after jurisdiction, strike the remainder of line 479 and through interviewer on line 480.
Great. Thank you so much. The amendments are before us.
Madam Chair, I'd move adoption of the amendments.
Second.
We have a motion to adopt the amendments. All those in favor say aye. Aye. Any opposed? Great. Delegate Bennett Parker, please explain your bill.
Thank you, Madam Chair. This bill defines Children's Advocacy Center and replaces the term Child Advocacy Center where it currently exists in the code. The bill also provides that if it is determined during a human trafficking assessment that a forensic interview of the child is needed, such interview may be conducted by a Children's Advocacy Center within the jurisdiction. However, if the interview cannot be completed within 14 days, the forensic interview may be conducted by a Children's Advocacy Center located in another jurisdiction. This new section mirrors language found in existing code about interviews of children during abuse and neglect investigations. As more and more children become victims of human trafficking, the legislation encourages referring the victim to a CAC should it be determined that a forensic interview is necessary. This provides the best outcome for the child during the interview process and follow-up for the child and the family after the case has been determined. This language is permissive, and we have experts here to answer any questions, and I hope it's the will of the subcommittee to report the bill.
Thank you so much, Delegate. Are there any questions from our subcommittee members?
Madam Chair, I have a question for the delegate.
Delegate Shin.
Thank you, Madam Chair. This just adds a definition for what is a children's advocacy center because that doesn't currently exist in code also, right?
Yes, that is correct.
Thank you so much. Are there any other questions from committee members? Okay. Members in the audience who wish to participate in support of this bill, please line up. Good afternoon.
Good afternoon, Madam Chair, members of the subcommittee. I am Janice Dinkins-Davidson, Executive Director of Children's Advocacy Centers of Virginia. We are the recognized state chapter of the National Children's Alliance, and we are a membership organization for Children's Advocacy Centers. And we are very much in support of this legislation, as the definition of CACs in code means that any organization calling themselves a child advocacy center has met stringent standards and can serve children at the highest level. So I'm happy to answer questions.
Great, thank you. Are there any questions from the subcommittee members? I don't see any. Thank you very much. Are there other folks who wish to speak in favor of this bill? All right. Or is there anybody who wishes to speak in opposition to this bill? I feel like we have a quiet committee today. All right, this bill with its line amendments is before us. Hold on, let me check if it has to go anywhere. I don't think so. Nope, it doesn't. It can just be recommended to be reported.
Madam Chair, I'd move to report with amendments.
Second.
There's been a motion to report this bill with as amended, and it's been seconded, so that's properly before us. Madam Clerk, are we able to open the roll? Oh, hooray. Okay, please vote. Delegate Bennett Parker, please close the roll. The subcommittee recommends reporting with amendments House Bill 1128 by vote of 8-0. Thank you so much. Delegate Hope.
Thank you, Madam Chair. Of House Bill 787 before the subcommittee, and I do have a line amendment that I haven't provided to staff, but I can read it to you. It is on line 33. I want to make sure I'm not going too fast. House Bill 787 on line 33. Agencies pointed out to us it should be 2.2-4027. You got it too. Okay, good.
All right.
Good.
Thank you so much, Delegate Hope. So the amendment to have the correct citation back in the code on line 33 is before us.
Madam Chair, I move adoption of the amendment.
Second.
Okay, so there's been a motion and it's been seconded to adopt this technical amendment. All those in favor say aye. Aye. Any opposed? Great. Delegate Hope, please tell us about your bill.
Thank you, Madam Chair. This is a very simple bill. This bill clarifies that due process protections are applied to beneficiaries who appeal decisions. The bill allows judges to order intermediate relief where a judge believes that an individual should have it granted. Intermediate relief is also allowed under other APA cases and just clarifies that they have that same duty there. That's the bill before you.
Great, thank you so much. Any questions from our committee members? Delegate Shin, are you? No, oh, sorry. Any folks in the room who wish to participate in support of the bill, please come forward.
Good afternoon, Chair and members of the committee. Emily Hardy with the Virginia Poverty Law Center, and we thank the delegate for bringing the bill and for working with us to clarify and make sure that the language is correct. And this really is seeking to set out that when these cases go to court, that a judge has the right to review the law and to make it clear so that when legal aid is working with people, they can give them accurate advice and to help make the decisions in what kind of cases they assist with. So we thank you for your consideration and hope you support the bill.
Great, thank you. Good afternoon.
Good afternoon, Madam Chair, members of the committee. I'm John Smina with the Disability Law Center of Virginia, and for reasons already stated, we support the bill.
Thank you so much. Are there any folks here to speak in opposition to the bill? All right. Questions from the committee?
Madam Chair, I'd move to report as amended.
Second.
There's been a motion. It's been properly seconded to report House Bill 787 as amended. Madam Clerk, if you can open the roll. Thank you so much. Please close the roll. House Bill 787 has been recommended to report with amendments by vote of 8-0. Thank you so much, Delegate Hope.
Madam Chair.
Delegate Cherry.
Good afternoon, Madam Chair, members of the committee. Thank you so much for your time. I'll direct your attention to House Bill 401. The impetus for this bill was over the course of the last year, I've been working to bring some labor trafficking laws to the Commonwealth of Virginia. And as we were sitting at roundtable discussions with many of the relevant players, both in the human trafficking community and in the administrations, we realized that the Department of Labor, the arm of the government that goes into workplaces and may observe violations of labor laws, was not a mandated reporter if they witnessed child abuse or some other things that should be reported. And so through that process, we thought that they should be. We worked with the department at length to make sure that we captured the right people, which are their inspectors, which are the ones that are actually in the field, going into these businesses to make sure that if there's children there, that they're safe. And that they're, if they do see anything, that they would have to report that to the authorities to make sure that it was properly investigated and that the violations would be corrected. So simple bill, that's all it does is add the Department of Labor inspectors to the list of mandated reporters currently in code.
Great, thank you so much. Are there any questions from the committee? Oh, Delegate Shin.
Thank you, Madam Chair. I would ask the patron if Department of Labor and Industry inspectors are trained in identifying and looking for signs of trafficking?
That is a great question. Everyone who's on the mandated reporter list, and I was forever because I'm an educator, is given state mandated training. It is very comprehensive in knowing what to look for, what not to look for, what is reportable and what is not. And so they would be subjected to the same exact training as every other mandated reporter in the Commonwealth.
Got it. So to clarify, Madam Chair, so they currently do not receive that training, but by adding them to this list, they would be mandated to receive that training.
Correct. You understand correctly, yes.
Great, thank you. And are there other questions from our committee? Okay. Are there folks in the audience who would like to speak in support of this bill? Are there folks who would like to speak in opposition to this bill?
Sorry to disrupt your quiet committee, Chair. Jason Hatcher with the Virginia Interfaith Center for Public Policy. First, we want to thank the patron for caring so deeply about what is a growing crisis. And we have been able to express some of our particular concerns on this legislation to their office. We understand that child labor is a massive problem, but we want to see an end to this in a way that allows for communities to be empowered. It is our position that coupling employees of the Department of Labor and Industry, whose duties include ensuring compliance with child labor laws, with mandatory reporting, as HB 401 does, could have some significant unintended consequences. We absolutely have a child labor crisis, as I stated. Concurrently, we have a crisis of underreporting on these issues, on child labor in particular. By the admission of many enforcement agencies nationally engaged with child workers, underreporting is a serious concern. To be able to tackle this growing crisis, we have to build more community trust in our current enforcement mechanisms. If families, parents, or guardians fear that they themselves will be investigated if they report a child labor violation, that will undoubtedly chill reporting, and it will make child labor harder to identify and investigate. So for those reasons, we are opposing the bill today.
Thank you. Are there other folks in line? Oh, hello. Yes, thank you. Please keep your remarks succinct as well so we can hear from everybody, but I appreciate you coming. Go ahead.
Thank you, Chairwoman Tron. I'm Valerie LaRue from the Virginia Poverty Law Center, and we oppose this bill. An employer is not considered a caretaker of children, so this bill will not impact employers. It will only impact families, and we're worried that it will bring great harm to families, bringing government intrusion into families' homes, potentially separating families and bringing trauma to children. It could also threaten immigrant families with deportation. And while we're not taking a particular position on Delegate Siebold's bill, HB 100, because it's not within the purview of the work we do, we think that is a better approach to addressing this issue. Thank you.
Good afternoon.
Good afternoon. Thank you, Chairwoman Tron, for allowing us to speak on this bill. For all of the reasons that were stated by Valerie LaRue, the Virginia Poverty Law Center, we, the Legal Aid Justice Center, and also the Virginia Family Preservation Project also oppose this bill. Thank you.
Thank you.
Madam Chair, members of the committee, Allison Gilbreth with Voices for Virginia's Children. We appreciate the patron for identifying this problem. However, we fear that this bill may create unintended consequences, and there's a significant underreporting issue within child welfare. And so we hope that this committee will not move forward with this bill, but we are committed to working on solutions in the future. Thank you.
Yes, Delegate Shin, were you raising your hand?
Yes, thank you, Madam Chair. I wondered if any of the folks who have spoken about it, about the unintended consequences, could maybe just like help me understand what some of those unintended consequences might be.
Thank you. Would one of the witnesses, I think, speaking for the organizations, come back to address Delegate Shin's question of what are the unintended consequences that you are alluding to?
Yes, Chairperson. I think that ours was a little distinct, but some of the unintended consequences that we fear may occur is especially related to underreporting. So particularly in communities that already feel vulnerable, potentially to officers of the state or people who are not familiar to them, are going to see the coupling of a compliance officer who is coming to report or coming to investigate child labor, if they also know that this person might be involved in their own families or communities' lives. Those coupling of those two things together, we feel like are going to create an unintended consequence that is going to drive child labor reporting underground.
Do you have a follow-up, Delegate Shin?
I do, Madam Chair. I'm sorry. I'm just trying to understand this. And so the underreporting, because a Department of Labor and Industry inspector would be going to a workplace. Like, you know, we've heard a lot of child labor violations in Virginia where kids are losing limbs. And so with that, if a person is coming in to inspect for other things, like other workplace safety conditions and hazards, I guess I'm struggling to understand how this contributes to underreporting instead of increasing the opportunity for someone else to be a reporter.
Yes, thank you, Chair. So we absolutely see that aspect of it. What this would do, right, is if folks knew that you're talking about situations where people are already investigating, but if there are things that are underreported, so investigations that are not occurring, and we know that community members could report on these child labor violations, but they're choosing not to because they are worried that that reporting will then be tied to them being investigated or their community members being investigated.
Sorry, I have one more question.
Delegate Shin.
I'm sorry. And so is the concern that the inspector is sorry, I'm trying to understand this. I guess if it's already being underreported in a specific community, we aren't necessarily adding more instances in which an inspector is going in. And so I guess I'm not, it's like not equating for me.
Delegate,
yes, go ahead.
Do you want me to respond?
Sure.
Yes. I think once again, we would reiterate that it's imperative that we build community trust to be able to stem the crisis of child labor violations. We don't feel like this is yet a community-informed decision. We don't know how folks will react to the idea of a compliance officer also being a mandatory reporter. And I feel like that is the most important question that we have, is what impact that is unintended will this have on underreporting?
Thank you. Delegate Auroch.
Thank you, Madam Chair. A couple questions of the patron, or maybe more than two as we progress. First of all, hearing the folks in the testimony saying they felt there potentially was some solutions here, given that I see this bill was pre-filed, did any of the folks who spoke against the measure approach your office with any suggestions as to how it may be resolved, and have you tried to address those?
We did have conversations with them, and they expressed their concerns to us, but as they've noted here today, if you're worried about underreporting, having more reporters is a good thing, particularly when they're already going into these locations for looking for other violations within the Department of Labor. And right now, if they saw something that involved a child, they would not be mandated to come back home and tell it. If it wasn't for what they were there for, they wouldn't necessarily have to say anything.
And Madam Chair, if I follow up to that,
Delegate
I wanna make
Auroch.
correct me if I'm wrong, the Department of Labor inspectors are coming out to the workplace where the employer is supposed to be reporting they have child labor and documenting that they're not exceeding the hours of such. And the whole purpose behind their being there is to protect the children that are being placed in these work environments. Is that correct?
Absolutely, yes, sir. That is absolutely correct. And these are some of our more marginalized people groups in our Commonwealth that are, many times having to go to work instead of going to school, or having to choose that balance point, if you will. And so we want to protect the most vulnerable in our communities, and I think that's what this bill does. Is the inspectors are already there. Let's make sure that if they see something, they say something.
And Madam Chair, follow up, I believe this would be my last.
Yes, Delegate Auroch.
Any penalty attaches to the employer for either non-reporting or for working the children longer than the hours. Ergo, that's why they're the compliance. Am I correct in that?
Yes, sir, that is correct.
Now we have a whole line of questions. Delegate Walker.
Thank you, Madam Chair. So, members of the committee, Delegate Cherry, I spent the last 21 years of my life working for DOLI, Department of Labor and Industry, as an apprenticeship consultant, going in, working with small businesses, setting up training programs. And we were encouraged, if we saw something of concern, to report that. So whether it was an OSHA-type situation or health violation, things like that. One of the things that I remember over the years is that there just wasn't enough enforcement people to follow up. When you call DPOR, it was, well, they didn't seem to think it was something that needed to be investigated. So I think this is a good bill. And in some cases where you have these mom and pop shops, especially in barber and cosmetology, I did see young people in there. They may be members of the family doing different chores. So whether they were considered laborers or not, it just reminded me that we need more people looking over, not government getting into your life, but observing whatever laws we have to ensure that there is protection there. So I would certainly be in favor of supporting this bill here, Madam Chair. Thank you very much.
Thank you so much, Delegate Walker. Delegate Higgins.
Thank you, Madam Chair. A comment with regards to the bill. I as well spent 38 years working in a construction trade association, and I'm not sure who would be better equipped to examine and inspect situations like this than the Department of Labor. I mean, currently they're inspecting apprenticeship standards, safety standards, equipment standards, workplace safety, building code violations, wage standards, underage working standards, proper compensation, air quality, and on and on. So I don't know who would be on a job site that would be more qualified to look into something like this or be there to look into something like this than the Department of Labor.
Thank you, Delegate Higgins. Delegate Cherry, so we heard public testimony for those who support, those who opposed. Do you have a last word for us?
It's always the simple bills that are difficult. But in this case, I think it really is a simple bill. We're sending these inspectors. They're already qualified by the state as the delegates so articulated about all the things they already look for. And again, this is about protecting and overseeing our most vulnerable in our communities, which are our children, and making sure that if they see something, they're mandated, not encouraged, not pleased, you are mandated to make sure that that is reported to DSS and we make sure that it's properly investigated and our children are safe.
Delegate Orrock, thank you.
Madam Chairman, I move to report.
Second.
There's been a motion, it's properly been seconded to report House Bill 401. Madam Clerk, if you can open the roll. Delegate Cherry, House Bill 401 has been recommended to report by a vote of 7-1. Thank you very much.
Thank you, Madam Chair, members of the Commission.
Delegate Tata.
Thank you, Madam Chair and members of the committee. Fostering Futures is an excellent initiative in the Department of Social Services that provides services for foster children aged 18 to 21. HB 1313 is a bill that extends the age from 21 to 23. Fostering Futures is a voluntary program that provides financial and social support and services such as housing, education, job training, assistance, or supervised independent living. As of December 2023, there were almost 800 foster youth in Fostering Futures. Unfortunately, Virginia ranks close to last in the United States in outcomes for youth in foster care. Many don't finish high school or even get a driver's license. 20% of foster youth end up homeless immediately after aging out, and after 18 months, that number increases to 40%. This leaves them vulnerable to gang activity, incarceration, and human trafficking. The extension of services will allow DHS, independent living programs, and community organizations more time to work with independent living skills needed to ensure a more successful outcome. We know that the average maturity of a healthy prefrontal cortex is age 25. Youth in foster care have experienced various levels of trauma, delaying this maturity, leaving them unequipped at 21 to succeed without a support system. I've worked closely with DSS, and I hope you'll support this bill, and I have some people I think here in support.
Delegate Tata, thank you so much. Are there any questions from our committee members? All right. Are there folks in the room who would like to speak in support of this bill? Please come forward.
Good afternoon, Madam Chair, members of the committee. Carl Ayers, Deputy Commissioner of Human Services at DSS. Thank Delegate Tata for her interest in supporting our youth that have been in foster care and are transitioning to adulthood, and we do support this measure. Thank you.
Thank you. Hello.
Hello, Madam Chair, members of the subcommittee. Allison Gilbreth, Voices for Virginia's Children. We strongly support this bill. Thank Delegate Tata for bringing this bill forward. Many of you met some of our youth from Virginia's Youth in Action earlier this week. We had one young person who was with us who was aging out of foster care in 30 days and said that she wasn't sure what she was going to do next. 21 for maybe a typical young person might be ready to launch, but for a young person who had not had additional support, age 23 would be a significant support to get them to successfully transition into adulthood. Thank you.
Thank you so much. Hello.
Thank you, Madam Chair. Valerie LaRue from Virginia Poverty Law Center. We also thank Delegate Tata for bringing this bill together. She's actually just very much right about all the outcomes for children who age out of foster care, and this could really ameliorate that. So we really appreciate her bringing the bill. Thank you.
Thank you. We have a question from the committee. Delegate Srinivasan.
Thank you, Madam Chair. Delegate, I have a quick clarification question. Would this have a fiscal impact? Or
Yes, it does. So this would absolutely have to go to appropriations.
Thank you.
Thank you.
Thank you. Please make note of that when we get to the end of our hearing. We also have somebody here in support online. If we can pull up our witness to come give testimony, Mr. Mark Stevens.
Good evening. Mark Stevens here. Appreciate Ann Tatefarrell for doing this for us. I am with Stand Up for Kids. We're a nonprofit who work with homeless youth. I've been doing this for over 16 years, and that's because I adopted a 14-year-old out of the foster care system. He was 14 at the time. He is now 31. So 16 years ago, when I first adopted him, our state was rated 50. We are currently at 47 as kids are aging out of foster care. And he came to me at a third grade level at 14 after being in foster care since he was 5 years old. I knew from that point on that I had a battle to fight. We cannot leave and take these kids and say we're going to treat them better. Sorry, I'm passionate about this. So I work with these kids that I see after the fact. The kids who have aged out of our system, the kids that we said, we're going to take care of you better than your family. And we haven't. We're letting these kids hit the streets at 20, 18, and not keeping them in where they're safe as an adults that we said we were going to do for them because their family couldn't. I have seen these kids trafficked. I've seen these kids in jail, and I've seen these kids end up in worse things. We have to improve this in this great state. Money shouldn't be an option for any of this. We need to be their parents because we said we're going to be their parents, and we need to continue to be their parents. I told my son that the average kid stays home till they're 27 in this country. That was the thing that he decided that was the best thing for him. But at 18, he really thought he was supposed to leave and pack his bags. On his 18th birthday, that's what he was doing. I told him, you did not have to leave, you were adopted, but these kids don't have this choice. And we made that choice for them. We got to protect these kids and do a better job. Thank you for taking the time.
Thank you so much, Mr. Stevens, for sharing your family's experience. Are there any folks in the room who would like to speak in opposition to this bill? Any questions from our committee members? If there's a motion to report this bill, it needs to go to appropriations.
Madam Chair, I'd move to report and refer to appropriations.
Second.
There's been a motion to report and refer House Bill 1313 to appropriations. Madam Clerk, if you can open the roll, please vote.
Thank you.
Thank you so much, Delegate Tata. Your bill has been recommended to report and refer to appropriations by a vote of 8-0.
Thank you very much. Thank you.
Thank you. Delegate Delaney.
Thank you, Madam Chair. I have HB 1366 when you are ready.
Thank you. Delegate Delaney.
Thank you, Madam Chair. HB 1366 establishes a process for local departments of social services to conduct background checks for current or prospective employees and prohibits local departments from employing any person who has been convicted of criminal offenses that relates to their employment. Failure to comply with this federal requirement could result in a $3.2 million fine from the IRS. So this bill would help the Commonwealth to avoid any possible federal penalties and make sure that we can continue to process TANF requests. And I do have some folks from the agency here to answer any questions about the bill.
Great. Thank you so much, Delegate Delaney. Are there any questions from our committee members? Delegate Srinivasan.
Thank you, Madam Chair. This is probably a question for the department. How does it work now? I was just curious. Thank you.
Yes. Thank you, Madam Chair and Delegate Srinivasan. Is up until now is the belief had been that only the individuals that were doing TANF had to have the background check. And so whenever they came in and audited us, anybody that has access to the system, they said have to have the background check. So even if they don't do it directly, we've got to have the background check for everyone. So it expanded the population that needs the background check. So now every employee that does benefits has to have the background check. This will catch everybody up, and then it'll just be part of our normal system going forward.
Thank you so much, sir. Are there any other questions from committee members? Anybody else here who wishes to speak in support of this bill?
Yep. And I would just say we're strongly supporting this and thank the delegate for carrying this on behalf of the agency.
Great. Thank you so much. Members of the audience, anybody who wishes to speak in opposition to House Bill 1366? Sorry. There's nobody online. Members of the committee, I'm double checking. Does this have to go?
Madam Chair, I'd move to report.
Yes. I mean, forward, just not to appropriations, that's what I meant. There's a motion to report House Bill 1366.
Second.
That's been properly seconded. Madam Clerk, if you can open the roll, please vote. All right. Delegate Delaney, our subcommittee recommends reporting House Bill 1366 by a vote of 6-0. Thank you so much.
Thank you, Madam Chair, and thank you, committee.
I'm next, committee. Okay, I'm going to hand the gavel over to Delegate Shin. All right. All right.
I'll try not to get drunk on the power.
Okay, I would like to open my comments. Yes, one moment, please. I'd like to say our committee has been batting 1,000. I hope to continue our good streak here. I'm kidding. Okay. Before you is House Bill 970, which would establish the Cover All Kids healthcare program for youth regardless of their immigration status. I believe that we've been working on either an amendment or a substitute to it. Could you report that, please, Council?
Yes, Madam Chair, that is, there's one line amendment on line 48 introduced after shall, strike the remainder of line 48 and through of on line 49, and insert consult with.
Thank you so much, Council. Let me just explain this change. So before in our enactment clause, we would like the DMAS to establish a work group, and we recognize that we don't need to have a full work group, but we just need some consultation in the process. That's the change.
I make a motion to move to report this.
I think the motion is to adopt the amendment.
Adopt the amendment. I'm so sorry.
Second to adopt the amendment.
Thank you. The motion to adopt the amendment has been moved and seconded. And so all those in favor of adopting the amendment, please say aye.
Aye.
Thank you. And now the amendment is properly before us. Delegate Tran, please continue.
Great. Thank you so much. Members of the committee, as I mentioned, House Bill 970 expands health care to vulnerable children in Virginia by creating a Medicaid-like program for about 13,000 undocumented immigrant children living here right now. We are currently ranked 25th in the nation for kids who do not have health insurance, and we have the 11th highest total of uninsured children. That's approximately 88,500 kids who don't have health care coverage. So this bill would cover 13,000 of those kids. And we think that it's so important that our families don't have to choose between seeing a doctor, getting medication, and getting the care you need now and also long-term over so many other stresses and demands in our lives. When uninsured kids are forced to go to the emergency room for care, state funding is then used to reimburse hospitals through the emergency Medicaid, and Medicaid disproportionately shares those hospital payments. And sometimes hospitals are not reimbursed for this care, and hospitals have lost anywhere from $75 million to $151 million in reimbursement costs in 2019. So by establishing a state-funded program to provide comprehensive health care coverage to kids in the Commonwealth who do not have existing coverage and would otherwise be ineligible for coverage because of their immigrant status, we're really excited about this opportunity to expand care for our children. I welcome any questions from the committee.
Thank you, Delegate Tran. Are there any questions from our currently very empty committee? Not seeing any questions. If there are folks in the audience in the room who would like to speak in support of House Bill 970, please come forward. Kick us off, Christian.
Thank you. Good evening. I'm Christian Martinez, Research and Policy Analyst at CASA. CASA supports the bill, but I am here to read a testimony from one of our members. So this is Sofia Carrillo. She is from Guatemala, and she has been living in the U.S. for 3 years in the city of Richmond, and she has been a member of CASA for 2 years now. It is an honor for me to be in front of you today to explain to you how important this is for me and my family on healthcare access to our needs. Since being an immigrant, it is much more difficult for us to have access to a medical service appropriate to our needs. This is very important. This is very necessary and important, especially for children. Today, we are here to ask you to change the lives of many children by voting in favor of accessible health insurance for the entire community, regardless of our color or immigration status. It would be a great help for us as a low-income immigrant community to be able to count on your support and protection. Thank you.
Thank you.
Dr. Barbara Boardman for the Virginia chapter of the American Academy of Pediatrics. Thank you for bringing this bill. We've been caring about this issue for a long time. Our members are in the situation of having to deal with, let's say, a child who's been in the ICU for an auto accident and they have to send them out without knowing what care is going to be covered. We say that there are at least 9,000 undocumented children in Virginia who don't have access to health care coverage, and 11 states currently use state-only funds to cover low-income children in health care coverage programs. So we are strongly in support of this bill. Thank you.
Thank you.
Good evening, Madam Chair, members of the subcommittee. Jeff Caruso with the Virginia Catholic Conference. Madam Chair, we thank you so much for introducing this legislation. We believe that health care is a right, not a privilege, and that it needs to be accessible and affordable to all. And for that reason, we supported Medicaid expansion a number of years ago, and we see this as a continuation of that, and for the same reason, we support this bill today. Thank you.
Thank you.
Good afternoon, Madam Chair, members of the subcommittee. I'm Freddie Mejia from the Commonwealth Institute. We support the bill. Thank you.
Thank you, Freddie.
Good afternoon, Madam Chair, members of the committee. My name is Davis Gammon. I'm with the Virginia Hospital and Healthcare Association, and we support the legislation and thank the patron for her persistence on this very important issue. As the patron mentioned, we believe that House Bill 970 will reduce cost and improve outcomes for all Virginians across the board by reducing uncompensated care and providing and promoting much-needed care to children across the Commonwealth. We hope it is the will of the subcommittee to report the legislation to the full committee. Thank you.
Good afternoon, Madam Chair, members of the subcommittee. I'm here representing, my name is Paul Berry. I'm here representing the Virginia Coalition for Immigrant Rights and the Virginia Coalition of Latino Organizations. We're very happy to see this bill being read, and we hope that it reports out. Thank you to the patron for bringing this to the attention of everybody, and we look forward to its success. Thank you.
Thank you.
Catherine Haynes on behalf of the Virginia Interfaith Center for Public Policy, and we strongly support this bill. Thank you.
Thank you.
Good evening, Nicole Lauder, Williams Mellon. I'm here on behalf of two clients, the Virginia Association of Free and Charitable Clinics and also the Virginia Health Catalyst, and both strongly support the bill. Thank you to the patron.
Thank you.
Good evening, Madam Chair. Scott Castro from the Medical Society of Virginia. The MSV supports this bill and thanks the delegate for her leadership on this issue. Thank you so much.
Thank you.
Hello, Chloe Edwards with New Virginia Majority. We serve working class women, people of color in particular, women, their family, and their children. We have a large population of our members who are immigrants. I remember growing up in Virginia schools as a child and being taught that America is welcoming to all. We're a melting pot. Bring your struggles, bring your cries, and we can work towards success. But I witnessed the barriers that are put in place for immigrant families in particular. And so to offer some support to certain children but exclude others is simply unjust. And so I hope that we can continue to be a more inclusive nation for all children. Thank you.
Thank you.
Madam Chair, members of the committee, Emily Moore with Voices for Virginia's Children. For all of the reasons previously stated, we support the bill, and thank you to Delegate Tran for being persistent and bringing this forth again. Thank you.
Hi, Zoe Aquino here from Humke Center. We represent our Asian American base here in Virginia, and I just want to note that this past year, our services team actually enrolled 7 families who would have greatly benefited from this bill into community subsidized insurance, and hopefully future families will be able to benefit from it as well. Thank you so much. We support.
Thank you, Zoe.
Good afternoon, committee members. Victoria Richardson from Virginia Poverty Law Center. We strongly support this bill, and thank you, Delegate Tran, for bringing this bill.
Thank you. I think we might have a couple of folks online also who are in support. So I'm going to call first on Christine, Dr. Christine Page-Lopez.
Hi, good evening, Madam Chair, for the opportunity to speak in regards to your bill. My name is Dr. Christine Page-Lopez. I am an Associate Medical Director at Neighborhood Health, which is a community health center in Northern Virginia, and I'm also a practicing pediatrician. I am here to represent the Virginia chapter of the American Academy of Pediatrics, as well as the countless pediatric patients of mine that do not have health insurance. For the past 10 years, I have been a pediatrician to a largely immigrant patient population who live in poverty. I've seen firsthand the extreme challenges that the lack of health insurance on my patients and families have. My uninsured patients have poor health outcomes and unmet healthcare needs. Their lack of insurance restricts their access to well child care, preventive health services, including routine vaccines and dental care. It's also associated with just poor management of acute and chronic medical conditions, which can then lead to increased use of emergency rooms and hospitalizations. And ultimately, those that do not have health insurance often delay or go without needed care, which can ultimately lead to worse health outcomes over the long term. And this includes medical, dental, and mental health problems. And just by providing this very unique group of infants, children, and adolescents with health insurance, Virginia can improve their medical, dental, mental health, as well as educational outcomes for both their childhood and their adult lives. So thank you so much for sponsoring this.
Thank you, Dr. Page-Lopez. And Megan Cox? Megan, if you're available.
Yes, thank you. Good afternoon, Madam Chair. My name is Megan Cox, and I'm an attorney and Gallagher Public Interest Legal Fellow at the Northern Virginia office of the nonprofit Kids in Need of Defense, or KIND. KIND provides free legal and social services for unaccompanied immigrant children who arrive alone to the United States. In fiscal year 2023, approximately 4,833 unaccompanied children were released to sponsors in Virginia, making up only part of all undocumented children in Virginia. Currently, Virginia Medicaid and FAMIS do not provide coverage for all unaccompanied children, as unaccompanied children are by definition undocumented. For example, I work with an 11-year-old client who's nonverbal with profound life-threatening and chronic medical conditions. Her doctor has confirmed to me that she would die within a matter of months if she did not receive critical care. While an immigration case can take years to resolve, children like my client, who herself cannot speak due to her conditions and whose family does not speak English, face the scenario of potential death daily without guaranteed care. This bill is a vital initiative that would provide relief for children like my client by expanding their ability to reach out for life-saving medical aid. It would ensure that children, regardless of immigration status, can access crucial, preventative, and critical medical treatment that would benefit the entire Commonwealth of Virginia. Thank you for your support.
Thank you very much. Are there any folks in the room who are here to oppose this very fine bill? And there's no one online. And so, Delegate Tran, if you would like the final word.
I would, Madam Chair. My heart is really full because in today's long line of folks who came out to support and who shared personal experience are people who've been in the fight for immigrant and health justice for a very long time. But also our coalition has expanded this year in particular to include new partners who recognize the importance of providing care to all of our kids. And I just want to thank all of our partners for making the time to come. This might be the first and only time that we make it out of subcommittee on a unanimous vote, I'm hoping. But I just really, it makes my heart full to see all of you standing together for our kids. Thank you.
I'm going to call for this vote really, really quickly before anyone comes back then. And so the committee operates by motion.
I make a motion to report this to the full committee.
Second.
I think
to appropriations. I make a motion to report and refer it to appropriations.
Second.
Thank you. I think the motion is to report and refer with amendments to appropriations.
I move to report I make a motion to report, to move and report the amended bill to appropriations.
Thank you, Delegate Srinivasan, and thank you. The motion has been seconded, and is Madam Clerk, if you would please open the roll. Madam Clerk, if you would please quickly close the roll.
Any hope for one more day, please?
Delegate Tran, House Bill 970 has been reported and referred to with amendments to appropriations on a vote of 6-0.
Yay. I think
Madam
that
Chair, I'd like to
concludes our
return the
docket
gavel
today.
to you.
Delegate Henson.
Before we adjourn, I just want to say that we all was elected here to listen to people, to help pass effective legislation. And I know people of this audience have taken the time, been up since 5 and 4 a.m. And to have one side of this bench not here, I'm just going to extend grace, and hopefully they are presenting other bills. That's what I'm going to go with. But I just want to encourage all of us to just be mindful of our audience and how we got here in the first place.
Great. Thank you so much, Delegate Henson. I think we're done with our docket today. Next week, come back. It's a very full docket next week. So if we can get a motion to adjourn, please.
Second.
All right. See you soon.